Firstly, I'd just like to say it's really hot here today, so anything more than this and I may cook. So that's my precursor and I'll get into it. So what is the public health problem? Well, as an Australian population, we currently actually face two problems. One of them is osteoarthritis, which is a major contributor to the burden of disease caused by musculoskeletal conditions, and the other one is an opioid crisis that we currently face. So around 2.7 million GP consultations regarding osteoarthritis were paid by Medicare in 2008, and there was around $1.2 million spent on osteoarthritis alone. In relation to opioids, 15.4 million prescriptions were issued in 2017 to over 3 million Australians. In total, around 32% of Australians are taking opioids, and that percentage is around the same for those over age 65. So why this opioid use is a problem is due to the side effects that they cause and the number of hospital visits they cause, which is around 150 hospitalizations a day. Now, originally opioids, and still do, serve a purpose, but that purpose is supposed to be chronic terminally ill pain, but we've seen an indication creep where they're now used for lesser forms of pain, and quite often pain associated with osteoarthritis in the elderly. However, this can be related to extra hospitalizations. So osteoarthritis actually affects primarily the elderly. Arthritis does affect both young and old, but osteoarthritis is more prevalent in those aged over 65. Some 2.1 million people were affected by it in 2014, so it's a large number. In those with osteoarthritis, half of them reported moderate to very severe pain, and they are 2.3 times more likely to report ill health in other areas of their lives. Commonly it occurs with comorbidity, and this often restricts the number of medications they can use for other conditions also, like NSAIDs, and it also makes them more high risk for the use of opioids, so an alternative needs to be found. Our government has actually taken the position to effectively target opioid prescription because they see it as such a problem and they want to reduce its use. So what we need to do is find a way that we can effectively manage pain while at the same time for our elderly allowing them to live healthier, happier, pain-free lives. So how are we going to do this? Well, we have come up with a concept of a project which takes a centuries-old practice, that is acupuncture, which is now actually backed by quality evidence, particularly in areas of low back pain and osteoarthritic pain, and we want to place that into a community treatment environment. So importantly, acupuncture has shown effectiveness in reducing pain enough in other areas to actually reduce the need for opioids and other analgesics. So by this program, we want to target pain, but then we also want to put it into a social group treatment session to encourage social interaction and foster resilience in our elderly. These are other areas that have shown that in chronic pain management are really beneficial for ongoing treatment of pain. So, how will the program actually work? Well, what it will be is initial 10 weekly treatments for those with osteoarthritis and chronic musculoskeletal pain that are over the age of 65, and this will be delivered in community centres or aged care facilities for those who can't leave that facility in metropolitan and inner regional Queensland. The treatment will continue then fortnightly after 10 weekly treatments on admittance to the program. Now, importantly, you need to have a GP referral for this program, and you also do need to be on prescription pain medicine, so there'll be analgesics and preferably opioids to see the major change that we want. Ultimately, this project aims to decrease pain in the elderly with osteoarthritis and chronic musculoskeletal pain by 50%. In order to reduce opioid prescription, and we are looking for an overall decrease in opioid prescription over 4 years of 30%. So we also then need to make sure that we can evaluate our success to see if this program is working. So how are we going to do that? Well, pain scores will be collected at every treatment, and on every 10th treatment this information will be collated and forwarded to a GP who can then discuss with the patient whether a revision to their prescription medication is possible. Other information will also be recorded that is really important, and this will be occurring on entry into the program and then again on every 10 sessions. So that particular information will focus on their current activity levels, the medication usage, any use of mobility aids, how active they are, and will also importantly conduct quality of life SF36 scores just to get a gauge of how they are going. And then on every further 10 treatments, this baseline data that we recorded initially will be recorded again and compared and forwarded to the GP, who again will have more on-time information for them to be able to see if a revision of medication is possible. Optimally, as the program progresses, pain medication prescription and their usage rates will decline. What we also anticipate to see is that hopefully those SF36 scores will increase with quality of life increasing, and optimally we'll see some increases in their physical activity occurring also. Thank you.